Thank you, Sahani sir, and thank you, Hindi team, for the beautiful Hindi session. So now it's time for our English session. Hello, friends. Myself, Dr. Neha Kakkar. I welcome all my fellow and co-doctors to the 1707th webinar of the English session tonight. And we'll start our session with the daily routine prayer. So as today it's our 1707th session, as we all know that IFPH, that is International Forum for Promoting Homeopathy, organizes daily webinars related to homeopathy and health. And we have our Hindi session from 7:30 to 8:30 and our English international session from 8:30 to 9:30, then the local Malayalam session from 9:30 to 10:30. So the guest lecture for tonight, today we have our lecturer as Dr. Yamini Vashishtht. Dr. Yamini, you have joined?
Yes, Dr.
Welcome. Yeah. So I'll give a small intro for Dr. Yamini. Yamini is a BHMS MD and she has done her BHMS from Baxton Homeopathic College and Hospital in the year 2018. And her MD in Homeopathic Materia Medica from Dr. M.L. Dhavle Memorial Homeopathic Institute in Palghar, Maharashtra. She has been practicing privately since 3 years. And today she has our first session here at IFPH. And her topic today is relevance of the modern biopsychosocial model in understanding homeopathy and homeopathic materia medica. So welcome, Dr. Yamini. And it will be great to hear from you. You can start your session.
Thank you so much. I can share my screen, right?
Yeah, sure.
Please allow me to share my screen.
Just a second.
Please make Dr. Yamini co-host.
Thank you.
Yes. Okay, now you can share.
Thank you so much. Okay. Is my screen visible?
Yeah.
Yes, thank you. Good evening, everyone. I am Dr. Yamini. I hope I am loud and clear.
Yes, yes, you are very much audible, ma'am. Yes.
So we'll start our session, and this is something which I learned during my MD, and I would like everyone to know that what is biopsychosocial model and how it can help us to understand the concepts of homeopathy and also the homeopathic materia medica. So first of all, we'll go to the overview. So let me just get this here. First of all, we'll know what is biopsychosocial model, who gave it and why did he feel the need to propose this model. Then we will see how it is relevant to homeopathic concepts and how it is relevant to homeopathic materia medica. And in a very concise manner, I have tried to study CPR through BPS model. So I will show you all how can we study all the remedies in homeopathic materia medica through this BPS model, and then the conclusion. So first of all, what is BPS model? What is biopsychosocial model and who gave it? It was proposed by Dr. George Engel, who was an American psychiatrist, and he was actually concerned about the psychosocial aspects of illness within hospital. So he was a psychiatrist. He was working in hospitals to look at the psychosocial aspects of diseases, and he realized the limitation of then famous biomedical concept of disease. So he realized that the severe illnesses have high burden of suffering, and also that these are very costly. If we look at the severe illnesses, for example, if we take diabetes, it is a severe illness. If someone has hyperglycemia and is admitted in hospital, so first of all the hospital charges, and then when he or she gets discharged from the hospital, he has a lifelong burden of the disease of suffering, and may also lead to disability if someone gets a diabetic foot. that may need amputation. So so the consequences are very difficult to handle. So what he thought is, it is better to avoid the disease or manage them before it gets very complex. So he thought that it's better to curb the diseases at primary and secondary level through prevention. And if you look at prevention, prevention always has the interaction of psychosocial factors such as lifestyle or the social capital or health literacy. So all these kind of factors and affects the primary and secondary prevention. So in 1977, in a paper he published, he proposed this holistic biopsychosocial model, which will now look what are the components of it. So this is the then famous biomedical model versus the biopsychosocial model. So if we see on the left side, the biomedical model, it is very disease focused. It focuses on disease, on the illness, and not health. It is just concerned with identifying the etiology, what causes the disease, that also in a very physical realm, that is what kind of bacteria or virus causes the disease, to diagnose the disease and to intervene through in a physical manner. So that was the focus of biomedical model, and it assumes that just absence of disease is physical health, and it was more intervention focused than prevention focused. What Dr. Engel proposed was biopsychosocial model. On the right side, we see it is in the center the patient, how he experiences the illness, that is the center of this model. And it assumes that health and illness both has many causes and can produce many effects. So these are the three major components. Under these, there are so many components which act and interact together and affects a person's health or illness. And if we see, it considers health as a well-being, as well-being at biological, psychological, and social spheres. That is what the current definition of health is by WHO. That is, it's not just absence of disease, it is well-being at biological, that is physical, psychological, that is mental, and social spheres. Then only we can say that a person is healthy. So it focuses on prevention of disease and early management, and then the normal, which was there, that the physical intervention, that comes later. So we need to focus on prevention of diseases and early management. Now we'll look at the components separately, and I'll give examples of each. So first comes the biological factors. A few of these we are well aware of. First one comes gender. Of course, there are few diseases which each gender is predisposed to, like reproductive health. We see that female reproductive health diseases are different from that of males. Then comes genetic vulnerability. The genes or the genetics, it disposes each individual to different kind of disease, and diabetes or hypertension or even mental diseases now are considered that these are genetically predisposed than what comes later. Neurochemistry, it includes the alteration in neurotransmitters like dopamine and serotonin that greatly affects a person's mood, and also the hormone imbalance that also cause disease. Infection and illness, of course, these are the main focus of the biomedical model also, that infection and various kind of infection leads to various sickness. Physical trauma and disability. So physical trauma and disability also predispose patients to, it affects a patient's overall health if we see that way. And substance use, that is what do you say, the addictions to different kind of drugs that disposes patient to certain kind of diseases. STDs, if we see, are transmitted by using used needles. So this is one of the example how substance use predisposes a patient to different diseases. Then comes the psychological factors. First comes the mental health, emotions. It is included in that, because if emotions are not channelized or well balanced, that lead to deviation in mental health. Then comes attitudes and beliefs of individual we are talking about. So very small example, like I remember my grandmother when I was small, she got sick during Navratris. In North India, people fast during Navratris, and she used to eat only once at night. So she used to fast the entire day, and she fell sick, and doctor had told her to take medicine after eating something, and she refused it. She said, no, I will not break my fast, I will eat at night. So luckily nothing serious happened, but this is an example how attitudes or beliefs of a person may predispose them to severe illnesses, or even act as a block to cure. Then personality traits, persons, for example, who are very fearsome or anxious, are more predisposed to certain kind of diseases. During COVID, we had seen how anxious individuals, not even patients, they did not contact COVID, but anxious individuals were more prone, because they'll be over concerned about it, and that affects their mental health and disposes them to brings their what do you say, immunity low, and they contact diseases. Then coping skills are how an individual reacts to the different situation. So of course it affects a patient's short term and long term decisions, and how they treat disease or disease in a certain manner, how they are coping with the normal situation, which can be avoided or can be channelized in a better way. So this is how coping skills affects a patient's health. And the social factors, this is less considered less important, but we should understand how this is one of the major causes equal to the previous two. So how the interpersonal relationship affects a person, how cultural and societal norms. Example of this is how women all over the world are treated differently during their postpartum stage. So in different cultures they are treated differently, but one major common thing is confinement, that they are not allowed for a month or 45 days, they are not allowed to move out, they are just confined to the one room, and things get stricter in few cultures. So that these kind of things lead to postpartum depression. These are some of these are the causes of postpartum depression. So this is how culture and societal norms can affect a patient's health. Then comes socioeconomics. The lack of money or financial freedom leads to constant worry or fear, insecurity, which may lead to which there is a persistent stress which predisposes patients to diseases. Then family circumstances, example, if an individual has a sick person at home to take care of, or more than one sick person or disabled person to take care of, so that continuous physical exertion or the frustration leads to diseases. Education and health literacy. So education and health literacy leads to disease and also acts as a blockage towards health. For example, it is easier to teach a person who is educated about contraceptives or about reproductive health than a person who is illiterate. So it gets difficult to teach them or to bring about changes in their day-to-day life, and that leads to health diseases at some or the other point. Then comes the work environment and community. We are now seeing that how overloaded work or meetings or stress and anxiety of workplace leads patient to various things like overweight, obesity, diabetes, or even constant mental stress that may lead to depression. So all these kind of negative environment which patient works in leads to disease. And if the individual doesn't has a community to vent out or to share their problem, that also leads to depression or even biological factors, that means the physical kind of disease. So it affects, so these three components acts together. It is not just that the social factor will just affect the physical component. All three interact and act on each other, and that affects health and disease. Now we look at how the BPS model or the biopsychosocial model is relevant to homeopathic concepts. So first we'll see the integration of mind and body dynamics. BPS model emphasizes on interaction between biological, psychological, and social factors in health and disease. Homeopathy also gives importance to mental and emotional symptoms along with physical complaints. So BPS model embraces the concept of holistic approach towards patients. So it is one of the steps of modern medicine of recognizing the concepts of homeopathy. So even our master, Dr. Henneman, he was dissatisfied with the treatment of that time, and he came up with the concepts of homeopathy, and he put forward his concepts, and he was criticized for it. And so was Dr. Engel. He was also criticized that the BPS model is vague and it is not specific, because biology is not specific. It is very vague. It differs in each individual. So it is very difficult how social it is very difficult to specify how exactly the social components affects the biological, because it may differ to patient. So that's the first relevance of BPS model. Then comes the individualization of treatment. So the BPS model, it supports the patient center approach, as I told you, not the disease focus. It is patient focused. So homeopathy also is fundamentally based on individualization, which implies that each human being is individual, and each individual is prescribed uniquely, assessing patients' peculiar, rare, and specific symptoms. So we differentiate or segregate the common and uncommon symptoms, and we prescribes on the uncommon symptoms of a patient than on the common one. So this is how it is relevant. If we understand the dynamics of these three components, we can understand how they are working in each individual differently, and we can prescribe better. Understanding miasms and chronic diseases. So the BPS model perspective helps us to understand the miasmatic influence through predispositions and tendencies, because BPS model also talks about the predisposition and tendency of an individual. And these predispositions also are not just biological, but they are also shaped by the psychological traumas and socio-environmental stress. If we talk about predisposition, most of us instantly may say genetics. It is not just genetics. It is there are psychological and socio-environmental stresses also with that predisposes a person to disease. Now we'll see how it is relevant to the study of homeopathic materia medica. So first of all, the two previous relevance, that is the holistic approach, the integration of mind and body, and the individualization which BPS model gives. It is very effective and good for us to understand homeopathic materia medica, because through this frame it allows us to go to understand the deeper or the core of the remedies and not just the list of symptoms. We can read the list of symptoms, but if we do not understand the core, how each remedy is different, so it gets difficult. So if we study our medicines through these three components and how they are interacting in each remedy, then we can match it with the patient and we can prescribe better. So first one, we'll look through the components of BPS through our homeopathic materia medica. So under biological components, there are physical constitution, physical causes, physical modalities, and pathological affinities. So when we read our medicines or remedies, there are physical constitution given. You may see the build of the given there. Patient may be fat and flabby, or slim, or lean and thin, So the different kind of skin, some may have dark complexion. So it's mentioned how the physical constitution of the patient is. Then the muscle fibers, somewhere it's given lax muscle fibers, somewhere it is given robust muscular fibers. So this is the physical constitution. Then comes the physical causes. We see ailment from, and there are so many ailment forms which we read about. So ailment from cold or injury or eating certain kind of food. So we have causation and effects in different causation and effect in different remedies. Then the change of weathers or the timing. So these comes under the physical causes. Then physical modalities, the aggravation or amelioration through the physical factors like rest or motion or different kind of positions, warmth or cold. These all are physical modalities, and all our remedy have some or the other pathological affinities which we read about to certain body parts or to different parts or tissues. So for example, sulfur has affinity towards venous system of the body, or the cicuta or nux moscata. These remedies have an affinity towards central nervous system, and so on. Then comes the mental constitution, the psychological component. In this, we have mental constitution, then we have mental causation and modalities, then the intellect and memory, and mental state. So, mental constitution, we see that the patient at their healthy state also have certain kind of mental predisposition. For example, irritable or mild or zealous, quarrelsome. These all are the dispositions of a patient. And for example, pulsatilla is the disposition of pulsatilla is mild. So we will not think about pulsatilla in quarrelsome or irritable patient. We'll think about brainia or nux vomica in these kind of dispositions. So this is how the mental constitution works. Then mental causation and modalities. Here we have ailments from the mental causes. That is, for example, grief or fear, fright. We have all these kinds of ailment forms. Then consolation or consolation aggravation, or aggravation or causation from anger. So these all comes under mental causation and modalities. Our intellect and memory, this is also comes under psychological component. For example, weak memory, or being indecisive, or the exhaustion from mental work, patient is unable to think or has indolence. So these comes under intellect and memory. The component, one of the component of the mental generals given by Dr. Kent. So we can view that through BPS in this way. Then comes the mental state. So mental state is the current state of the patient. So it is affected by the mental constitution of the person. So weeping or desire to be alone or sadness, these are the mental state. So these are the psychological components of BPS in our homeopathic materia medica. Then comes the social components. This is under this we can see family and relationship, occupation and social roles, economic and environmental factors, and culture and societal influence. I've given example of each. Like family and relationship, we see death of loved ones or absence or of one or both parents. For example, in magnesium, we see that how the absence of parents affects the whole body or human economy, how the individual is affected because of that one thing, which is the absence of parents or death of loved ones. So these are this is not personal. The psychological component are personal. Okay, the social comes, for example, ailment from grief may differ. If we talk about in natrimute, death of loved ones will come under social ones, because that is someone the individual used to love and now he lost that person. So that relationship is the core of that ailment from. So that comes under social component. Then the culture and societal influence. Example, sympathy for others suffering. So it is looking at others, the individual is feeling that suffering, and causticum has this very clearly given that how causticum individuals are affected looking at others suffering. Economic and environmental factors, caring for sick, we have ailments from nursing or caring for sick. So these are the environmental or family factors, how person is affected by them. Then the occupation and social roles, we see overworking or zealous or very hardworking individual as nux vomica's, the silicias, they are very good and in their workplace. So how each remedy or each medicine acts differently in different social and environmental situations is another subject of interest. Like how nux vomica, if they are given everything, every good workplace, how they will be reacting. Or for example, if natromutes, we know only the diseased aspect of natromutes, ailments from loss of loved ones. How will natromure be if they have their that one-to-one relationship with the one person, and that person is there, he or she has that secure relationship? So how will they behave, or how their components will be, how, what kind of disease will they be disposed to? So this is another aspect of interest. Then in a very concise manner, I have tried not the list of symptoms, but only these components, how they are seen in sepia. So the biological, psychological, and social components of sepia. So at center we have sepia. First comes the biological factors. Obviously, we know that women are more disposed to sepia constitution than males. Males also do have that sepia constitution, but women are more disposed. So we see how the physical constitution of sepia women are. They are tall, slim women with narrow pelvis and lax fibers and muscles. Another physical components we see is the hormonal imbalances in all the reproductive states, that is be it menopause or be it premenstrual syndrome or during pregnancy or postpartum. So the individual is predisposed to disease during these stages. Causation, the physical causations, ailments from, we find blows or fall or jar or injury, overlifting. So the cause and effect is also given. Overlifting may give rise to dyspepsia, or the tobacco leads to neuralgia. The laundry work, that is ailments from getting wet, so it's called washerwoman remedy. So they have skin complaints after the laundry work. So that is one of the biological factors. Affinity towards, so the remedy has affinity towards female reproductive system, skin, GIT, and nervous system. Then the modalities, aggravation from cold air, wind, cold wind, sexual access. So there is aggravation at rest, there is aggravation from moist weather, aggravation before thunderstorm, amelioration from warmth of bed, hot applications, and violent exercise. These are the physical modalities of sepia. Then comes the psychological factors. Their diathesis or disposition is hysterical. Causation is anger and vexation. Anger and vexation leads to various kinds of diseases or ailments in them. Irritability, and these are the mental state. Irritability and indifference to loved ones is the mental state. Aversion to consolation. There is indolence, unfit for mental labor. They do not want to do anything. They do not want to think. So feeling burdened and mentally exhausted. These are the mental state. Then comes the social factors. Now we see how the social aspect affects an sepia individual. Sepia individual. So these women are, we see, usually overburdened homemakers and caregivers. There is lack of emotional support in family roles. tendency to isolate. They desire solitude. There is dread of meetings. They do not want to meet anyone and want to stay alone. Feeling isolated or neglected despite fulfilling responsibility. They just keep on doing their responsibility, but they are very dissatisfied with whatever they are going through. And there is aggravation from contradiction or suppressed desire. We usually see as sepia, if we see, these are the individuals which desire independence. They desire independence. See, we see usually we say that these females are like male trapped in female body, so they want to have that autonomy, that independence. But due to all these social factors, how the social factors is very major aspect of sepia, because being a female, they are expected different things. Okay, be even if they are homemakers, they do not want to go out, they want independence. How I want to work in my house. If they are burdened with, you have to wake up at this time, you have to do certain things this time, or you cannot go out, or you cannot do this, you cannot do that. So there is that suppression which that individual has, and that leads to all these kinds of ailments which we read in sepia. So this, somehow we see how the three components, they interact with each other. If we see the interaction of biological factors and social factors, we see that hormonal problems are even worse if there is stress of social roles. So a person who is a sepia female, who is burdened and who is dissatisfied at work, at their workplace or in their homes, that leads to hormonal problem, and that even versus the other aspects, other two aspects, that is social aspect and the psychological aspects. For example, aversion to sex leading to marital disharmony. So this is example how the biological factor is affecting a social factor. We see the interaction of biological and psychological factor. There is physical exhaustion with emotional burnout. So it is not just the psychological factor that the patient is irritable, or the social factors that they want to be alone. It is because they have that physical exhaustion. They have been working that much that they do not want to meet anyone, or they do not want to talk about anything. They are aggravated by consolation or contradiction. They just want to be by themselves. Then comes interaction of psychological and social factors. There is emotional numbness due to constant caregiving and no appreciation. They are just keep doing their responsibilities, and they're not appreciated enough for that, and that leads to that emotional numbness. We the symptoms which we read about, that there is indifference to the loved ones or their work which they used to love. So that emotional numbness comes from this social factors, that they are just doing their responsibilities for which they are not appreciated enough. So this is a very concise way to see sepia, and in this manner we can put our other homeopathic remedies in this manner, so that we can understand the core, and we can also make interactions like arrows, like what is leading to what is the causation and what is the effect. We can to understand in a more wholesome manner, and from cause to effect, what is leading to what. So if we see this, the entire homeopathic concept and the BPS model concept, so there is predisposition, both mental and physical. There is environmental and social factors already existing. Then comes the causation, be it mental or physical. These three components, individually or acting together with other two, leads to a disease or disharmony, which is physical, mental, and social deviation, all three. So there is hardly any case where you just see that one thing is just leading to only one thing. So the all these three factors act together and they lead to disease, and disease also has these three components: physical, mental, and social deviations. And to treat it also, we have to see what are the causation at each component, and we have to eliminate the causation or the maintaining cause. Only then we can achieve health. So sometimes we see it gets difficult, like if we see a female, a CPR female who is trapped in a marriage where she is being beaten or there is violence against her. She is earning, but she is unable to leave because there may be some kind of emotional attachment still there. So that acts as a maintaining cause. That is a social component, that the relationship is so strong to break that she accepts suffering than to leave it and be free of it. So the maintaining cause, sometimes it is there. So it is important to identify them at least, because sometimes the disease or the symptoms may not be relieved after our medication. So if we know that this is the maintaining cause, like if you stay in this marriage and if you keep on stressed, or if you have this emotional blockage or suppression, you are not going to be healthy ever. No matter how many medicine I give you, you are not going to be cured. So this clarity we should have, and what is leading to the obstacle. So if we have that clarity, we can treat or treat the patient better. So the conclusion that the BPS models, first of all, it bridges the science and philosophy gap. So it makes materia medica more relatable to modern clinical reasoning and patient care model. So it becomes more relatable to today's world if we look at it through the BPS model. Then it enhances the understanding of mind-body dynamics, that is the holistic approach. Through interrelations of these three components, we can understand the patient and remedies better. It also enhances the case taking and analysis, because it deepens patient understanding and remedy selection through multidimensional understanding. If we understand each remedy and each remedy in such manner, we can see these three component acting and interacting in patient, and we can match that and prescribe. Encourages empathy and observation. Obviously, homeopathy values patient narratives, so it also helps us to understand or give that sympathy that patient needs if we understand all three components of patient which they are going through. And it also enhances how we do research and evidence building. So linking homeopathic concepts with the BPS model can help bridge the gap between the mainstream research and making homeopathy more relatable to the scientific community. It becomes more acceptable if we look at it through the BPS model. So this was it. I hope it was you were able to understand and have some new insight to our homeopathic materia medica and concepts of homeopathy.
Yeah, Dr. Yamini, it was a very wonderful and beautiful session. You had a very good command over your language and presentation. It was wonderful. And this biopsychosocial model, as we say, we are kind of integrating homeopathy with the conventional treatment of psychology and psychiatry and psychotherapy, whatever we can say in the medical terms. And obviously, this is the need of the hour, and this is the future we see for homeopathy and also conventional, where we are stressing on the integration of things. And psychology is a subject in which homeopathy has a forte, as an upper hand already.
Yes, always.
Homeopathy has an upper hand already than the modern day psychologist, as we can say.
I remember, Doctor, I was in BHMS, and we were during our internship, we had to go to a government hospital, and there was this psychiatrist under whom we were posted, and she had something against homeopathy. We later got to know the reason, but she was like, why you people are here? I'm a psychiatrist. What will you learn from me? Or what homeopathy has to offer in psychiatry? And I couldn't say it then, but I was like, what you people are doing? Actually,
no, you should have said it.
Homeopathy is very useful.
We have more 200% more than to offer than you people. I mean, we are not here to compete with anybody or need to downgrade somebody, but it's getting proven day by day that homeopathy can cure many such diseases which are deemed or labeled as incurable or intreatable. by the conventional mode or the allopathic mode of treatment. And slowly the chapters are turning up, and day by day, we are seeing difficult and incurable cases getting treated by homeopathy, and that too on the basis of mental symptoms.
True,
So,
true.
what more proof do they need to establish the efficacy of homeopathic medicine
Definitely.
than our own cases? So, I mean, I would like to say, so that was a beautiful presentation. I would, as Dr. Yamini, we have 15 more minutes left. So, can you give one or two example of cases where you can, explain this model in a practical way more?
Yeah, definitely I can.
Because we have 15 more minutes, so we have ample amount of time.
Yes,
And that will be a practical insight into the theory also.
definitely. Because this is something we had done this during our MD, and I will have to just what do you say, the details of the cases are lacking, because I'll
Yes.
have to go through the details, like which component has different causes or the
Yeah.
symptoms.
That's okay.
That is
You can
lacking.
say
But
whatever you are remembering and whatever you can share here. That
yes,
would be good enough.
so
Yes.
yes, this patient who came, a female patient, we had a long discussion over her during our sessions. She was, as I was mentioning, she was from a low socioeconomic status, and
Okay.
she has some female reproductive issues. And she came for it to us, and she was being treated. And when we look at the life space of that patient, and there was this socio-economic component, as well as the psychological component, which was going there, that her husband used to beat her, and she has that aversion towards that person whom she used to love. She married that person after running from her house, and she had that love
Okay.
marriage. And
Yeah.
after a few years, she was just tolerating it, because her family is not going to take her back. So she has nowhere else to go. She is
Okay.
suffering because this is the only person who can give me shelter, or at least that status that I'm a married and living with this person. But that was almost useless, because that person is neither giving her the emotional support or
Sorry.
the financial support. He used to just drink and beat her to take money from her, which she used to work at people's house, and she used to earn, and take that money and drink alcohol, and again come and beat her. So that was the thing, and we had to and she was illiterate, so it was very difficult to make her understand that what is going with you is not just
Yes.
your disease. It is
Yeah.
happening because there is that psychological and that social component
Yes.
which is acting on you, and
Yes.
it is difficult to cure it until unless these maintaining causes are not going to be eliminated. So she had relief, but there was always remission. She used to have that cervicitis, the attack of cervicitis every 2-3 months, and she used to come for that. So the acute were managed, but the entire case was always like on and off. She used to be relieved and again come to us. So that was one of the case which I remember, because of these two factors which were acting as the maintaining cause, and the biological factors or the symptoms were coming again and again because of those what do you say.
Okay. So, what medicine did you prescribe there?
There to her it was sepia. It was
Okay.
sepia given to her.
CPI in higher powers. Higher powers. 1M or 10M?
10M.
Okay. Yeah. Obviously, whenever we talk about psychological or psychiatric cases of depression, anxiety, and all those things, and
Higher
other
potency.
relevant things, we think of higher power medicines.
Mhm.
Obviously, we can start from the lower potencies and go higher up in the ladder.
Yes.
Yes. Any more case you want to share? Because we have time left.
I would also like
Yes.
other senior doctors to share or add
Yeah.
to.
Anybody else who wants to share any psychological case like Dr. Yamini has shared, having that social and psychological component here, can do that? Can raise their hands? Yeah, just a second. Somebody is raising the hand. Yeah, Dr. Ashok.
Yes.
Yes, Dr. Ashok.
Uh,
Yes, sir. Please go ahead. And Dr. Ashok, please unmute yourself.
is it okay?
Yes, yes. Now it's okay. Yeah, we can hear
Okay.
you.
Good
Yeah.
evening again.
Yes, yes.
I'm not exactly to talk about that case which I have in mind after listening Dr. Yamini, but I
Yeah.
have to congratulate her and to
Yeah, yeah.
say
Sure.
compliments for that, what work she's talking about.
Yes.
Before going to have another two words, I want to ask her where to find such a literature as you have spoken about sepia. Very, very fantastic. Believe me that, Dr. Yamini.
Thank you
That
so much,
how
doctor.
we can understand psychologically, other than this simple 2 pages of different doctors, two many our gurus are there,
Yes.
but still that you work did it, how to find such a literature of our material, even the polygraphs, it's not that we have to find 5,000 remedies with your work, at least polygraphs where we can find it. I have this number. In case it is possible, I can ask Dr. Neha or you directly to send me at email or something if I can find any of the literature. Second thing,
Yeah.
okay, please answer.
Yeah, Dr. Ashok, I have also recently completed my diploma in clinical psychology. And if you want the literature, I can send you the email or the things you can see those things there. It's there, this biopsychosocial model and
Yeah,
the
yes.
psychological impact of diseases is very much mentioned in that, all these things. Obviously, Dr. Yamini can also offer some things, I guess.
I
Yes, yes.
hope so. Yes, yes.
Yes,
So
yes,
there
yes.
are
So you can,
two, three books which I
yeah,
refer for psychology
yes,
in homeopathy. One is the personality profile of major
yeah,
constitution remedies by
yeah,
Philip M.
yes,
Belly, and then there
yes.
is
That's a wonderful
another
book.
one.
That's a wonderful book. Yeah,
Yes, and there is one huge 3-volume book by Catherine R. Coulter on
Oh, yeah.
psychophysical analysis of selected constitutional types. So, in very detailed manner, it is given how our constitutional remedy, the psychology, and how it functions in each case with detailed examples. Like I was talking about how. Nux vomica or a natrum mule will behave in a healthy environment if they do not have that ailment from which we usually talk about. So how will they behave, how what kind of psychology or their behavioral symptoms be like. So it is very wonderfully given in that book, Catherine Coulter.
Thank you, Dr.
yeah, yeah.
Yamini.
Dr.
Again,
Ashok, you can share your email here. I can send you the literature on your email. Or
okay, I will write
yeah,
down here
yeah. In the
in the
chat box,
chat
you can
box.
type your email. Yes, sure.
Perfect, yeah, perfect. I'll request again to send me some material and the indications about
Yeah,
the book so that it's really. Thank you
yeah.
very much.
Yeah,
Good
yeah,
evening.
Dr. Yamini, yeah, there's a question one for you in the chat box.
Yes.
Uh, yeah, it's written, how can we use this approach in case of any health issue in a younger children, but not limited to adolescent age, that can be related to psychosocial profile? If yes, how? You
Okay.
can read the question in the chat box, please. Yeah.
Yes, I can. Can you give me the symptom which the patient many bad behaviors? Okay. Another, this is the psychological aspect. If we say bad behavior, this comes under the psychological component. Along with this, we see if we talk about bedwetting. So that is the biological
Yes.
symptoms which we usually see in children. So uh, obviously the psychoeconomic and the psychological aspects, how components which interact is usually we see these kind of quarrelsome or irritable or badly behaved children who are usually single child, who do not have siblings. They are well pampered, and they have a they are from a good economic background. So they are that environment makes them that kind of a person who behaves or who does not consider about the feelings of others. So this is how the socioeconomic or the environmental factor
Yeah,
works
you
in
can give
such children.
example of 2, 3 more biological cases, like you said, bedwetting, and what
Okay.
more conditions we can associate along with that psychological things.
Then there is psychological, there is stuttering. Okay, you are talking about the biological things, right? Stuttering and these all are the psychological aspects of psychological components. Biologically, what are cases? I'm unable to think right now. I'm so sorry.
That's okay. Yeah, you can have stuttering, you can have bedwetting. Then there are certain, you can say certain anxiety symptoms, like children come in with complaints of palpitations or headache, frequent
Oh,
headaches also.
right.
Yes, and frequent headaches, frequent palpitations, or even body aches and pains. That is also sometimes due to anxiety and depression issues in them. We can consider that also.
As I was
Or
talking about this coping mechanisms, there are
yes,
also this certain psychological theories like that of Freud and that of Eric Erikson, if you are aware
yes,
of.
yes,
So the
yes, yes,
development of a child, Eric
yes.
Erikson has given how
Yeah,
at
I
various
think
stages.
psychology as a subject should be introduced in BHMS, because that will form a foundation for the homeopaths. Because we can see, like for example, when we are studying the physiology and anatomy part, we can also study the background of psychology,
Psychology.
and the different aspects of it, whether diagnostic or what are the interventions we are having about psychotherapy and psycho. And I'll be taking a session on psychology this few days from now. So
Okay.
we'll talk about integrating, how we can integrate psychology with homeopathy and use it in our cases, in different cases,
It was
difficult
very important
cases.
because knowingly or
Yeah.
unknowingly we do use those psychological what do you say, be it CBT or this kind of we
Yes.
unknowingly we
Yes.
use it, this
Yes.
kind of
Yes.
therapies
Obviously.
with the
Yeah. We are
patient,
not
but
using it. You can say knowingly,
consciously.
as you.
Yes.
Yeah, consciously.
So
But
it
we are
is
doing it all the time. Yes, it is.
so it is important.
So
If we know what to do in what case,
yes.
consciously if we do it, it will be more
Yes,
effective.
and we can introduce some, the medical part of it, like the diagnostic test, the intelligence tests, or we have those specific psychological questionnaires, and that will help you to, like providing the evidence that the allopathic physicians ask us, what are you doing?
Definitely,
So
definitely.
we can show them the evidence through those tests, that this was the case before, now it is like this. What
Like
are the
this.
changes occurring in the diagnostic, like we do in the other MRIs and ultrasound?
Hmm.
So this way you can integrate both the things and do a lot. So अभी यहाँ पे डॉक्टर राम परवेश शाह जी भी कुछ कहना चाहते हैं सर. हाँ जी, डॉक्टर राम परवेश शाह जी सर.
Thank you, Dr. Neha Kakkar, and congratulations, Dr. Yamini. Very good
Thank you, Doctor.
presentation. Excellent session. Dynamic lecture, and describe the biosocial factor and psychosocial factor. It is depend of biosocial and psychosocial factor in a anatomical disbalance of electrical disbalance factor, biosocial and psychosocial. Electrical disbalance after harmonial disbalance after biosocial disbalance.
Yes.
So it is depend of electrical. यानी इलेक्ट्रिकल मीन्स इलेक्ट्रॉनिक, इलेक्ट्रल मीन्स शीतजल पावक गगन समीरा, जिसके कारण से बीमारी का कारण है, कॉजेशन है. डॉक्टर हैंडमैन, हाँ, डॉक्टर हैंडमैन अप्रोचिंग 72 disease, acute and chronic, acute disease and first disease, indisposition, maintenance cause of disease, and chronic disease. So very, very thanks. Describe the CPI is a very good describe.
Thank you, Doctor.
Yeah. There's one more question for Dr. Yamini. There's a case of 10-year-old girl who came with early menarche and she got bullied at school and Staph 6C was prescribed. Anything else to improve? So it was answered by somebody. That
It was me.
yeah. You are the one you are answering. Okay, counseling can help. Yes. So
Like understanding why the child is in such a state that they are unable to stand for themselves or unable to share what the community, the importance of community I talked about in the social factors, whether they have someone to talk about it whom they trust. Maybe like they wouldn't talk to us instantly, so is there someone else they can talk about it? So identifying these kind of causes, what is going to into that mind of that little child and how that can be vented out or resolved is necessary. And as we were talking about how we can help through counseling, if we know that what kind of psychological actions we need to take in that certain case, so that will greatly help the patient along with the remedy.
yeah, so you are having a lot of appreciations coming here. Dr. Kumar Samba has sent you great explanation, Dr. Yamini, and Dr. Abdul has sent you some flowers for the nice session.
Thank you so much.
Yes, so Dr. Abida Salam has said, well conveyed session. Yeah, so it was obviously indeed a wonderful session with Dr. Yamini today on understanding the, yes, Dr. Namra is also appreciating you.
Thank you so much.
Yeah, so it was a very wonderful session with Dr. Yamini today on understanding the biopsychosocial aspect of materia medica along with the homeopathy and integrating of both the things into our practice. And I hope it was our first session, but it was a very, very wonderful session, and we'll have more sessions from her along with some very nice cases that will be a practical insight.
Yes. Sure.
Yes.
Thank you so much for giving me this platform. Thank you to Dr. Basil, who has given me this opportunity and this platform that I'm able to share whatever I know and we can discuss on the topics. I'm looking forward to all other webinars also, so that I can also learn. And it is a very nice group of homeopaths and senior homeopaths. Yesterday also I had joined the session where the doctor was talking about the case of Naja. So it was very informative, and I never thought to prescribe such remedies in such cases. So it was very insightful. So I'm very glad to be here and be a part of this group.
Yeah, thank you, Dr. Yamini, for the session. Now it's time for our Malayalam local language session, and I'll hand over the session to Dr. Mariama. Thank you all.
Thank you.
Thank
Yeah,
you,
Dr. Mariama. Yes.
Thank you, Neha Kakal.
Yes. Should I make you the host, Dr. Mariama?
Yes.
Yes, just a second.